Rhode Island's field hospital sits at the ready tonight. Governor Gina Raimondo ordering the state to run drills at the Cranston site. Good evening. I'm Mike Montecalvo.
And I'm Shannon Heggie. It's all in preparation, she says, for a hospital overflow of COVID-19 patients. 12 News reporter Brandon Truitt got a look inside. He joins us now live with how it will all work. Brandon?
Well, Mike and Shannon, this site has been set up since April, but it's not been needed. Governor Gina Raimondo says if the state stays on its current track, COVID patients could be coming into this center within the next 2 weeks.
This is an option, but we want to do everything we can to avoid using this.
Doctors saying activating the field hospital isn't a shoo-in, but they're ready in case it's needed.
We had just team members here working every single day.
12 News cameras getting an inside look at the field hospital in Cranston. This is the old Citizens Bank call center transformed into a medical marvel. Rows and rows of more than 350 beds, each with its own oxygen supply. This space is designed for COVID-19 patients. There's a pharmacy here too.
We put a lot of thought into what type of patients we would care for here, who belongs here, who doesn't.
This space will only be needed if current COVID hospital beds in the state fill up. Governor Gina Raimondo is saying that could happen within the next couple of weeks. Right now, the team here is working to staff the place with many medical professionals already running on E.
We are all at the brink right now. We are all taxed beyond belief. We are all stretched. Every last resource is being used. Every last space is being used.
Although the state is headed in the direction to activate this site, the doctors here say there's still time to change course, but it's running out.
If people stay home now, if people avoid social gatherings now, if people avoid any unnecessary activity now, the pandemic can be stopped in its tracks.
And those doctors say that staffing is proving to be a little bit of a challenge. So many doctors are already spread thin. There is a call tonight for anyone with medical experience to consider stepping in to help. Live in Cranston, Brandon Truitt, 12 News.
Healthcare workers are now readying a field hospital in Cranston, hoping they won't have to use it. 12 News reporter Brandon Truitt got a look inside the facility today and joins us now live. Brandon?
Mike and Shannon, I got to tell you, this is just not something we're used to seeing in this country. Bed after bed, all lined up in rows here. The doctor's telling me that they're ready when needed.
This is a last resort.
Cases on the rise and hospital beds filling up. Dr. Laura Foreman says this last resort is quickly becoming inevitable.
This is an option, but we want to do everything we can to avoid using this.
What was once the Citizens Bank call center transformed into a makeshift hospital. Those running the site say it's been in place since April, and they've been running drills here ever since.
We had just team members here working every single day.
More than 350 beds separated into 3 pods. This space is designed for COVID patients. There's oxygen at each bed and an on-site pharmacy too.
We put a lot of thought into what type of patients we would care for here, who belongs here, who doesn't.
The state says this field hospital cost $8 million to set up. Another $3 million a month when fully staffed, and up to $15 million a month when at capacity. The state says that number will go up to $15 million a month when the hospital is staffed and ready to receive patients. All of that said to be coming from federal funds. In the meantime, doctors say the need for this space is likely, but it's not set in stone.
This is an option once we have run out of every other option, and it absolutely is something that we can avoid. If people stay home now, if people avoid social gatherings now, if people avoid any unnecessary activity now, the pandemic can be stopped in its tracks.
And we heard similar sentiments echoed by Governor Gina Raimondo just yesterday. The governor saying that unless people change their behavior soon and in a drastic way for the better, COVID patients could be rolling in here within the next 2 weeks. Live in Cranston, Brandon Truitt, 12 News.